This is the third program in the series Finding, Organizing and Using Medical Information, created by the Network of African Medical Librarians and Deans with support from the U.S. National Library of Medicine, Bethesda, Maryland.
Hello, I am Nancy Kamau. I'm the Deputy University Librarian, Kenya Methodist University, Kenya. In this module, I will discuss searching techniques. Are you drowning in an ocean of information? Are you frustrated when looking for information? Are you spending too much time and retrieving too many irrelevant information for your learning and research? If you answer yes to any of these questions, then this module will be beneficial to you. It will introduce you to skills and techniques that will assist you in making effective searches. One thing to consider is that good searches are planned, not accidental. Information searching is like a journey. One needs to plan on how to arrive at the desired destination. In the same way, one needs to have a search plan or strategy that will help to articulate the required information. What is a search strategy? This is a plan that involves a few steps. One, define the topic clearly. How do you define the topic? By formulating the search statement or the search question. For example, malaria infection in children in Africa. That is a search statement, and that is a statement that will be used to prepare for the search. After the search statement, choose appropriate keywords. In our search statement, the keywords would be malaria, infection, children, Africa. But there is a caution while choosing keywords. Take into consideration related terms or synonyms. For example, adolescence could be represented by teenage, or a baby by infant. So those are synonyms. Take into consideration variations in word spelling. There are English and American spelling versions, especially in medicine. Take into consideration word endings. It could be in plural or singular. Take into consideration acronyms. For example, HIV, AIDS. So those are considerations that one should take within the search strategy. 3, use appropriate search tools. For example, PubMed. Number 4, apply appropriate search techniques. And we shall see how the search techniques are applied. Such techniques are useful for search precision. For example, you can retrieve too few references. What do? You can receive too many references. What do? You can receive no references, retrieve no references at all. What do? A search technique will help you in such situations. So the search techniques are various, and one of them is Boolean Logic. And what is Boolean Logic? This word is borrowed from mathematics. It's a logical relationship of terms. And this technique helps in combining keywords to either narrow the search or broaden the search. And it uses 3 operators. There is one called AND, or AND, OR, NOT. And each of these are used in either narrowing or broadening the search. Boolean logic also uses Venn diagrams to illustrate how keywords relate to one another. And these operators should be used in the uppercase so that they are not confused with the normal AND, or not in the natural language speaking. So Boolean logic, I'm lost. Boolean logic can be available, presented in various formats within a search engine or within a search tool there can be implied logic, so that if you enter your keywords, they are combined automatically, and that is how PubMed and Google uses Boolean logic for like A and D to combine two keywords together. Boolean logic can be presented as symbols. A plus sign refers to A and D. A minus sign refers to NOT, not. Boolean logic also can be presented in a template format so that it allows the user, to put in the relationship that the combination that you want your search to be. But the question here is to check the availability from each search tool. Another search technique is phrase searching. And this phrase searching uses quotation marks that surrounds a phrase. For example, we can have a search statement, HIV/AIDS and tuberculosis. So if we surround HIV/AIDS and tuberculosis in quotes, we are asking the search engine or the search tool to search the exact words, one closely related to the other. So it means that we are going to achieve relevant results because the search engine won't search tuberculosis in any other place, HIV/AIDS in any other place, except when the two of them are together. But this phrase searching can be used with caution, especially when searching in PubMed, because PubMed automatically combines the words. So if the words is in the search statement in quotation marks, it may be missed during the automatic term matching. So a few relevant results may be missed in that case. But it's always cautious to check how a search tool does the searching. Another search technique, truncation and word cards. And this one uses symbols to either represent a character. For example, we had talked about the spelling. It could be English or American spelling. And the user is not sure which one is which. So using a character like a question mark representing just one character can either retrieve spelling in English or American. Another symbol is the $sign or the asterisk. This one represents the variation in word headings. So we want to expand the search. For example, the use of asterisks in the word child can retrieve child, children, and childhood. So we are expanding our range of the word headings. Using asterisks also retrieves plural and singular word forms. Another search technique is field searching. Field searching applies to fields as presented in an electronic document, because information in electronic documents is presented as fields, as the data fields. You can have title, author, journal article, or journal title, abstract, or language. So these fields can help retrieve necessary information. So searching through a field search focuses the search. E.g., you can search through author search, you can search through year, or you can search through language. Our tool PubMed provides a template for the user to use a field search. So there is a template form that makes using the field search more easy for the user. For example, our search statement, malaria treatment in children in Africa, we can do a search in PubMed, and then we can retrieve like 2,000 records. But if we do a field search, like we want to refer to just children under 23 months, or for the last 2 years, we just get 11 records. So we have reduced our search from 2,000 to 11 records when we do a field search. Parentheses is also another search technique, and this technique uses more than one Boolean operator, and this makes the search more focused. For example, a search on prevention of diabetes would put diabetes and then the search operator A&D into brackets, prevention or control. So we are telling the search engine or the search tool, search prevention or control first because it is in brackets, and then combined with the diabetes. So the user is controlling the way the search engine will do the search. So keywords in brackets are searched first, then matched with results of keyword outside the bracket. In the absence of the brackets, all keywords would be searched at the same time, and this may affect search results significantly. Another search technique would be use of subheadings. Subheadings are used to build a search for relevancy and focus. Subject headings, like the medical subject headings, are used to help in making the search more focused. For example, a search statement, management of malaria in pregnancy. We can use a subheading to focus the search to management, either through drug therapy, nursing, or prevention and control. So subject headings are equated to controlled vocabulary or thesaurus, but they help in making the search more focused. So in summary, a successful online information retrieval requires development of a search strategy, use of appropriate search techniques, and learning how to use each search tool, e.g. PubMed. If you need further assistance, please consult your librarian. Thank you.
Please see all the 7 training programs in our YouTube series.